I'm Shannon Ladner-Beasley. I'm Program Manager for Contra Costa Health Services Health Career Pathways in the Office of the Health Services Director. In response to COVID-19 in Contra Costa County, I'm currently working with my team and staff to facilitate listening, outreach, and education efforts in historically marginalized communities. I'm speaking today to reiterate what we know is a serious issue, but it's also an urgent issue. We want to shift the conversation as a plea to show compassionate action to protect ourselves and each other. We've reached a critical point in the fight against COVID-19 across the nation and here in Contra Costa. After a period where we significantly slowed the spread of COVID in our community, coronavirus has not only made a comeback, but we're seeing record numbers of cases and hospitalizations for the virus now. Tragically, more than 119 Contra Costa residents have died from COVID, including 7 on July 29th, which was our highest local one-day total since the pandemic began, and there were 3 deaths today. There are now 2.5 times more people with COVID hospitalized in the county than at the start of July. We're standing here today in the city of San Pablo, which has the highest rate of COVID transmission in the county. COVID has impacted historically marginalized communities, particularly the Latinx community. While the Latinx population makes up only 26% of the population here in Contra Costa, they make up 40% of the cases in Contra Costa. We are joined today to share an important call to action. We have Dr. Desmond Carson, who is a physician here at Lifelong Medical Care, as well as Supervisor Gioia, who represents District 1 on the Contra Costa Board of Supervisors.
Good afternoon, Desmond Carson, 26-year ER doc, as well as a Richmond resident, lifelong Richmond resident. I'm here to reiterate that was so eloquently said before me, that this COVID-19 has come back to haunt us again. We are in a new outbreak. The data shows that there were 7 people who died yesterday. Of those 7, only one of those persons was someone who lived in a long-term living facility. While we offer our condolences to that family, we also are trying to note that those other 6 people were a new demographic. We're having a younger generation of people 50 and below, that are dying from this disease, and we're spreading it, as was said, in Contra Costa, in particular San Pablo, faster than anywhere else. Disproportionately, Black and brown people are getting this disorder and are dying from disorder. So we are here to say that we have a plea from everybody in this community that it is time for us to step our game up. It is time for us to work together and respect the guidelines from the public health community. Namely, everybody should wear a mask, and everybody should wash their hands frequently. Everybody should practice social distancing, and we need to make sure that we do this ultimately every day, daily, in and out. Otherwise, we are in trouble. We are definitely in trouble as the year progresses on. So please practice these practices such that we could deal with this and end this epidemic.
Good afternoon, I'm John Joya. I live in Richmond and I represent West Contra Costa County on the Board of Supervisors. We're here to continue to work with our communities to prevent the spread of the virus and to really urge action, even more immediate action that we've all been taking. As you heard, we had the largest single daily death rate yesterday when 7 people died of the virus, 6 of them through community spread. We are also seeing significant increases in communities like Richmond and San Pablo and Bay Point, communities with a high percentage of Latinx population. Those individuals who are often our frontline workers, work in essential businesses, and live in households that are often more crowded, have been contracting the virus at higher rates. So as you heard from the doctor, the message is we all need to wear a mask. We all need to social distance. We all need to get tested, wash our hands frequently, and please don't go out if you feel sick. The county's been working to expand testing countywide. Here in West Contra Costa, we just opened a new testing facility in North Richmond to complement the site here in San Pablo and at Kennedy High School. We're working with the City of Richmond for a larger test site near the auditorium in the city. We also started a new youth ambassador program because we understand that peer-to-peer education is often more effective than from the county to individuals. So this new program kicked off where young people receive a stipend to be trained from the health department and to work with other young people through social media and other means to get the message out of why it's important to take preventative steps and what to do. We're looking at expanding that program as from youth ambassadors to adult ambassadors. We also now have a hotel available for those who may be unable to social distance at home. Since early June, 50% of the cases have been contracted from other family members, other household members. And 15% of the cases since early June have been in households of 6 or more. So we know that some families cannot always self-isolate at home. So if you test positive, when you are contacted by a contact tracer, they will talk to you about how to avail yourself of staying in a hotel and being supported there so you do not infect other more vulnerable family members. We understand it's also important to work with our local communities, with leaders in the Latinx and African American communities to get the message out. So we've developed an outreach plan in both those communities, and we want your help and your cooperation and your expertise as we continue to put out an education message. We've beaten this virus before. By working together, we were able to overcome the surge in March and April and into May. However, as you heard from the doctor, there's been an increase again. 74% of our ICU beds are full. We do not want to reach capacity, and it's going to take all of us through prevention and yes, testing. Even though testing has taken longer to get results, it took me over a week. There are statewide supply chain issues that we all as counties across this state are working to try to solve. Despite that, it is still important to get tested. So thank you for being part of helping us save our hospital capacity and save lives.